Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you today about altering the treatment. A lot of times class 3 cases, especially in men, get worse as they get a little older, somewhere up in their later teens and everything. I've had them actually grow after they got to be 21, but usually the father or whoever, the children of it, if you look at their parents and the parent got worse as he got older, the child will too. So anyway, this is a rather interesting case, and I thought it was going to be a mild class 3 to start with, and we went in and took out one lower anterior tooth. That would all we need to do it, and then he grew further and further out, and we had to come back and take out his 6-year molars. He had wisdom teeth. Now, if he had not had the wisdom teeth on the bottom, we couldn't have done that. So this is an interesting case. I'd like to run through it as quick as I can here, and we'll get this going. Let's see, I don't know whether I've got the little dot. Did you get the name marked off on it? Okay, let's start out here. Here is this young man, and he's a real nice kid. He doesn't have anything much that shows it except that the lower teeth are a little bit out in front. You can see where they're coming out like that, just a little bit. It's going, and as he gets older, it comes out further. And so we'll go through this and show you. Here is the models when we started. He has a crossbite over on this side here. This side looks pretty good, but see the molars out front of that. And over here, you've got a case that's kind of leaning in one direction, where this side is out further than the right side's out further than the left side, right there. Now let's go ahead and show the upper and lower teeth, and no big problem in here except that on this side these teeth are out further over here, and so it's not going to be a real problem to correct something like this. And so we'll get in the x-rays. Now we're starting this guy in February, it looks like, of 1980, and his age 10, and 1 month at that point. And at this time the second bicuspids are coming in like that, and you can see the problem that's beginning to form in here. Now he has, of course, the 6-year molars there, the second molar, and he luckily had wisdom teeth too to go with this. So we'll go. This is he's age 11 now. This is 1981, and we kind of get around to starting, and so we think it's a rather mild case. And then look back here at age 13, it got worse as we started working on him. And here it was worse. We decided we should take out one lower central. You take one lower central and then you move the other one to the center of the line, and that would take care of the class 3 problem. Well, we see he's got wisdom teeth forming back here. You can see wisdom teeth all the way around. Now, so we went on for a little bit longer. This is 1983. And here it is. He's age 14 and 8 months, and this is 1984. And it just grew further out than that. And so we decided we would have to take out something. And so we took out his 6-year molars, and then you'll see we'll move this second molar up into this place and the wisdom tooth here, but we'll stop it, far enough to have a class 1 relation out in the front. Now this is just watch class 3. If you can look at the parents and down the line and see that I don't think I found a class 3 that was somebody in the family that had the class 3, even if they had to jump over to a grandparent, something like that. So we'll watch this. This is 1984, and he's 14, nearly 15 years old, and this is getting worse. And so we have to come in, and we're going to take out this. I had him take out the 6-year molars. Now, you can see we're going to drag this tooth forward. Now, this tooth right here, this line would be down. As we pull it, it'll bring the roots forward with that. Same thing over here. On the other side, we'll bring these roots up. This you can have a little deal on that, or you can just run it down. As you pull it forward, that'll make the roots come along with it. You can watch this grow. This is 1985, and I'm going to go to 19, already he's age 15, this is 11 of 85, and we've already got this tooth all the way over there. Now, people have asked me how long it takes you to do that, and you can look here, this was 8 of 84, and we sent him in to get those out, and this is 2 of 85, so that's just over into 85, and now by 11 of 85, we've got the teeth over there. In other words, this is a second molar that was here, and we brought it up here in that length of time, and you see the bone is filled in good around. He's got his wisdom teeth, and they're headed in here. And they'll go up against the upper second molars there. Now, this is 1986, and the wisdom teeth are almost, they're headed in. You need to put something to hold this up. Don't let these teeth get out too far. Sometimes we put, and he's 16, nearly 17 years old. And so we've got to get that wisdom tooth up or put a retainer in there that keeps this tooth from dropping down in that area. Now we're going to go to 87, and the wisdom teeth are in. This one's kind of falling behind, so we might just straighten it up some. And we apparently did that age 17 and about almost halfway to age 18 before we were through with that. And we got that wisdom tooth here is going to have to be elevated up. And we did that, we picked it up, and now the guy he's age 27 at this point, and this is 1997, and we go back to 1981 when we started the case. So the wisdom tooth is in over here. Either we brought it in, we must have put a little deal on it and picked it up after we were into treatment, but I don't have a picture of that. Now let's look at it. This is 97 here, and here was 1981, and you see the teeth were just coming out here. And so it got fairly big. We thought we could treat it by just taking one lower anterior tooth, and that didn't work, so we dropped back and got his wisdom teeth. I mean, his 6-year molars out and treated it. And here it is in 84. We've got him back there pretty good. And now this is 85. He's looking good, got a good facial profile. The teeth are underneath with an overjet and overbite, which is good right in this part right here. And now let's look at him. Here his picture is about 85, something like that. And nice looking young man. The facial structure looks good. We had it in pretty good shape. And you notice we put the central right in the middle, the midline at that point. And then we had him in retainers back in 87. And we took out this, or had him remove his lower wisdom teeth, no, his lower 6-year molar, again. And we pulled that up and held those in place while we're waiting on the wisdom teeth to come in. So this is 87, and we've got that just about in by that time. And now we see this is 97 right here. And the wisdom teeth are in back here, and it's sitting like that. 97. And a little bit of a crossbite that's coming in. So here the case is in 1981, and here it is in 1997. That's about 16 years. So some of these cases you work on them for a long time, but we ended up with the teeth in the right position. The front teeth, now as he got older, this opened a little bit right in here. He could have that filled in, but this is the 81 right here, and this is 97 right there. And so you can see you follow some of these cases for years before you get them right. But now we had to wait till he finished growing out here before you could really finish the case. And these are wisdom teeth, second molars. The 6-year molars are gone, and also one lower anterior tooth is gone. So you understand the length of time that you take to do a case. It didn't take us very long to move those teeth together, though. It was a good bit less than a year. You could go back and check that out. But this is 97, and up here above, these are 6-year molars, second molars, and his wisdom teeth are still there. And at 81, of course, he didn't have the wisdom teeth when he started. That's the 6-year molars. And they were removed, but not the upper ones, but the lower ones were. Now there, he took the lower 6-year molars and the lower anterior tooth, and this is the situation about 15, 16 years later. We could have squeezed that together a little bit more and into that. So here is the young man in 1987, and here is 1997 and 81 when we started right here. And you can see the teeth are lined up. You have a little opening here. You could have those two teeth filled with something and fill that gap or crown it if you needed to. I thank you for watching, and I think that's it. And hope you'll subscribe to our channel. And this is a long-acting case that you have to watch for a long time. And they grew further as they got older. And you have to change your diagnosis if you see this is going to happen. If you look at it, your parents did the same thing. You can plan on treating the class 3s after they're in their late teens and even up in his 20s. Thank you again, and I'm going to close up and stop it here.